let's talk about the best electric toothbrushes. Hi, my name is Whitney and I'm a dental hygienist here to talk electric toothbrushes. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands of people who have already discovered all of the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. I made it just for you, for it can help you stay on top of your daily dental habits at home and keep your teeth looking bright and white. Now, for the purpose of this video, let's put electric toothbrushes into three different categories. Number 1, Oral-B, or any type of oscillating, rotating powered toothbrushes. Number 2, Sonicare, or any type of sonic vibrating powered toothbrushes. And number 3, Quip. However, keep in mind Quip is actually considered a hybrid powered toothbrush. There's lots of these as well, and they actually have to be used differently than the regular powered toothbrushes, which we'll talk more about in just a bit. And by the way, I'm not promoting any of these. This is not a sponsored video. No one is paying me to say any of what I'm about to say. The only thing I may get is a small commission on some of the products that will be linked in the description if they have affiliate codes. So which one is the best out of these three types? Oral-B, circular round head, Sonicare, traditional vibrating heads, or the hybrids like Quip? I know you're not gonna love this answer, but hear me out. It all comes down to personal preference. Which one you like more? They all should properly clean your teeth as long as they are used correctly, of course, but for this video, let's just help you decide which one will work best for your individual mouth. Let's talk about the pros and cons of each, starting with Oral-B, the most common circular brush head. Oral-B's technology uses an oscillating, rotating series of movements. They spin. Lots of people like the feeling of these. Oral-B tends to have more affordable options due to offering more discounts and being on sale more frequently. And their brush heads, which you should change out every 3 months, are also slightly less expensive than the Sonicare brush heads. I really like these for patients with small mouths because it's a smaller brush head, so it's easier to fit in your mouth. Or if you have jaw issues and you can't open that wide, or if you have a gag reflex when touching your tongue or the roof of your mouth, these ones tend to be easier to guide exactly where you want them to go. So if you have trouble brushing your far back molars by your cheeks or by your lower back teeth, especially by the tongue, you can really get the Oral-B type brushes into these hard to reach places since the circular heads are often connected to a long, slim design. One thing to keep in mind though, if you have long teeth, long, tall teeth like mine, see how they are taller in the front teeth than the back teeth? You have to make sure you guide it along the entire length of your tooth. Don't accidentally miss the gum line by going straight across. Make sure you really wrap it around each tooth. Next up, Sonicare, which has a normal looking toothbrush head. Sonicare's technology uses vibrations and agitations. Most sonic toothbrushes look similar to regular manual toothbrushes in their size and shape, at least the heads of the toothbrush. However, just like Oral-B, you have to remember to still use all electric toothbrushes. You need to use them differently than regular non-electric toothbrushes. By the way, although lots of times you will see Oral-B with a little circle brush head like we just talked about, sometimes those ones do also offer traditional brush heads that look similar to a Sonicare, the regular toothbrush look. However, they will usually still have a portion of the brush head that spins as well. Regardless, although the Sonicares all tend to look similar to the regular manual toothbrushes, I'll say it once more, that you really have to remember to not use it like a regular manual toothbrush. And how to do that is simple. Just gently allow it to do its job, let it do the work for you by guiding it along the entire length from tooth to tooth. And since the Sonicare type brushes, since they tend to be larger, at least the brush heads tend to be larger, you're less likely to miss the top part of the tooth. But always check, no matter which toothbrush you're using, make sure you're not missing any spots because everyone's mouth is different. Some people do better with the Sonicares because they have larger heads and get all the surfaces, yet others prefer the slim design of the Oral-B. It's totally up to you. Both Oral-B and Sonicare are rechargeable, so they come with little chargers that they sit on, depending on which one you get. Within both brands, there's several makes and models of both brands. The more expensive usually means that the charge will last longer, and the cheaper ones usually mean that the charge won't last as long, and there will be less features included in the brush, which we'll talk about in just a second. Sonicare brushes tend to be a little more expensive as a whole, and the charge lasts usually around 3 to 4 weeks, whereas Oral-B brushes usually last around 2 to 3 weeks, the charge. But honestly, I don't know, I feel like both of mine last a long time, both of them. I would not base your choice off of how long the charge lasts, especially with all of the new models. The charger itself is such slim design, so if you travel a lot, It's really easy to just throw in your luggage. And now, before we move on to the hybrid toothbrushes like Quip, it's important to remember that Oral-B and Sonicare toothbrushes, everything we just talked about, are considered to be 100% completely electric powered toothbrushes. So you let them do the work for you. I've said it enough times, we get it. However, hybrid toothbrushes, such as Quip, are different from true electric toothbrushes. Because they are hybrids, they are half regular, half electric, meaning you are supposed to use a different technique from the electric toothbrushing technique. You cannot just let hybrids do the work for you, because they won't. They need assistance from you. You're actually supposed to use more of a regular manual toothbrushing technique with the hybrids. And I also have a demonstration video for the regular toothbrushing technique as well, which I will also link in the description box. Now, just looking at it, the Quip tends to be the sleekest and most aesthetic. Lots of people simply like how they look. And just like the Oral-B and the Sonicare, how there's a bunch of different brands that are similar to them. There's also a bunch of these hybrids that look like Quip now as well. I'll link a bunch of the product suggestions for all the types of toothbrushes below in the description if you're interested. But yeah, these Quip ones, they did have a little bit of a stigma, a bad, like in the dental world when they first came out, because dental providers were like, this isn't an electric toothbrush, it doesn't do the work for you, stop using it. But I think these toothbrushes were just misunderstood. The thing is, they are fine as long as you're using them differently than an electric toothbrush. Like we said, hybrids don't do the work for you like the full electric toothbrushes, so you still have to use some regular toothbrushing technique when you're using these. And it's so funny because us dental professionals, we were working so hard to inform and explain to our patients about using different technique with the electric toothbrushes. So it was confusing with Quip to be like, actually use this one like a manual toothbrush, you know? So the point is, now that these hybrids have been thrown into the mix, just remember to use them properly because it's a hybrid and it needs your help. Another pro of the Quips and the hybrids is that they were one of the first to offer subscriptions for the brush heads. It's a refill plan that replaces your brush head every 3 months, which is pretty cool because I know a lot of people forget to change out their toothbrush heads, their electric toothbrush heads, because they usually don't appear as worn out as regular toothbrush heads. But even if they don't look worn, it is so important to change out your heads every 3 months. Of course, I have a video all about that as well, which I'll link in the bottom bar below. But back to the subscriptions. I've recently seen that Sonicare also has a subscription type program now as well to get your brushes refilled every 3 months. So if they did that, you know all of the other brands will probably start doing it as well. So if the brush head refill is a feature you're interested in, it's another thing that you can find in each individual product's description. Now let's talk aesthetics and sound a little more, the audio. You can hear all of them, of course. They are not silent, but I do feel like Sonicare is slightly quieter than Oral-B. It's hard to say though. Oral-B just sounds more mechanical to me, and Sonicare is more of a humming noise. Everyone is different in what they prefer. Let's listen. Also, this is just word of mouth, but if you've never used an electric toothbrush before and you're thinking to make the switch to an electric toothbrush, I have heard that Sonicare takes more time to get used to when you use it because you really feel the vibrating in your mouth as opposed to Oral-B. But with Oral-B, you have to often pay a little more attention that you are reaching every single tooth surface of every single tooth because it is generally a smaller brush head, right? And with the Quip, I personally feel like it vibrates my hand more than it does on my teeth, but some people really like these, especially if they are hesitant to let the toothbrush do the work for them. Like if you really can't stop yourself from brushing, you like doing the motions, then maybe a Quip is for you. But if you're all about just placing it where it needs to go and guiding it along from tooth to tooth, then you can definitely benefit from the Oral-B or the Sonicare type brushes. And lastly, most electric toothbrushes have built-in timers. This is one of my favorite features because most of us have a hard time brushing for the full 2 minutes without a timer. Also, pressure sensors are another great feature to help you know how hard or soft to brush. So if you are someone with gum recession and you've been told by your dental provider to be more gentle when brushing your teeth, I would definitely consider using one that has a visual pressure sensor or a pulsing pressure sensor, something that will alert you to ease up on your grip. Sometimes you're holding it so hard and you have to remember, it reminds you. My Sonicare does this and my Oral-B does this. So it will say in the product description if it has the pressure sensor feature or not. All of the expensive ones do, but you'll need to double check with the cheaper ones. There are so many different price ranges and makes and models of each. So what I like to tell my patients is that you definitely don't want to buy an extremely cheap one, no matter what you're buying. The electric toothbrushes that are less than $20 are usually not that great. You really do get what you pay for. They are often battery operated and a bit too aggressive for your gums. I would stay away from those battery operated ones. Side note, they can be okay for kids kids. But for adults, it's much better to get in the mid-price range, usually around $40 to $80. Really, that's such an average estimate in a long span of prices. But I'm just saying, you don't want to buy something too cheap. Usually when it has batteries, no good. If it has a charger, it's usually better, the charger that you place it on. So don't buy something too cheap. And you don't need to buy something super expensive. Are the $200 or $300 toothbrushes better? Perhaps, with all the features. They have so many extra features, and once you use an expensive one, you'll be like, okay, yeah. Some people like to connect it to their Bluetooth and track their brushing and stuff. All these cool features can be cool. But really, when comparing solely how the toothbrush itself works, how it actually cleans your teeth, the mid-price versions, $40 to $80, and the premium versions, $100 plus, are oftentimes very similar. If you're paying more, it's usually because of all the extra features that are included. For example, like we said, most electric toothbrushes in the mid-price range have some type of built-in timer, so you know you're brushing for the full 2 minutes each time. But as the price goes up, the more expensive models tend to include more features, such as the pressure sensors that we were talking about, where it will alert you if you're pressing too hard. Some people can really benefit from that feature. I'd say that's the one everyone should try to look for. Some don't need that feature, but most people do, so look for it. It can't hurt to have a pressure sensor feature. You and your dentist and/or dental hygienist will be the best person to help you in decision making of which features are best for you. Since they know your unique dental needs, they can tell you which ones to splurge on or not to waste your money on, depending on your individual mouth. So in all, no matter which toothbrush you end up choosing, just remember that your technique is more important than the tool. Go for a toothbrush that you like, that you enjoy using, and that feels good in your mouth. You're going to use what you like more. Do you want the toothbrush to do the work for you? If so, probably get an Oral-B or a Sonicare, and I'll also link a few others that are comparable to those in the description box. Or are you really into your regular manual toothbrushing hand motions and you just want a little extra something? If so, then maybe try a hybrid. Whichever you end up choosing, I can't stress enough to always use proper brushing techniques, and of course, keep up with your home care of routine brushing at least 2 times a day, and flossing and/or cleaning between your teeth at least 1 time each day. Staying on routine and never missing a night of brushing will set you up for a brighter, healthier smile. And speaking of never missing a night of brushing, if you're interested in creating the perfect oral care routine to help make your teeth healthier, make sure to click the link in the description below or in the pinned comment to sign up for my free oral care guide. I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram @teethtalkgirl. Peace, love, and teeth.